And she's like, "Don't worry, like you got this. Just put all the work you need to, and you're gonna do good. Like don't." And I was like, I in those moments, like I actually needed those words because there's so many challenges in nursing school. Definitely hearing those words out of her mouth, like it encouraged me to do to continue, to not give up. And it's not an easy profession. You got to put all the work, but it's gonna be worth it.
Hey, Vanessa, it is so great to see you again. I want to start with, for folks who may be meeting you for the first time, can you share your name, the year you were a part of Future Ready NYC, the high school you graduated from, and where you landed after high school?
Yeah, of course. Thank you for having me today. My name is Vanessa Moreno. I was part of the Future Ready cohort in late 2023. I graduated from the High School of Professions and Human Services, class of 2023. So after high school, I attended New York University on a full ride, which I'm currently still in. So right now I'm a junior in my second sequence of nursing school at NYU Royal Myers College of Nursing. And that's basically what I've just been up to lately.
Congratulations. I'm learning some new things as we're talking now. So you're at NYU. I'd love to hear that. When you think back to the moment you were in the Future Ready NYC internship, how were you feeling about your future at that time?
What I remember was the program was just like geared towards students interested in the healthcare field. So at the time when we were introduced to the program, it was like targeted to students who were in the medical assisting program because my high school did have a medical assisting program, but I wasn't part of that cohort. So when they first presented the program, they're like, "Hey, we have this program. It's new. We want like students who are not in the like medical assisting program who never like got the opportunity to like intern at a hospital. We want to give these students like a chance." And I was like, "Okay, like, I actually wanna do this because like, unfortunately, I was never in a medical assisting program in my high school. So I was like, "Okay, like, I'm, like, really interested in this." Like, I signed up, like, right away. I was like, "Okay, I wanna do this."
No, that's really cool. And before it started, what did you think the Future Ready NYC internship program was going to be?
We came into our class, like, "There's this new program starting. Fill out this Google form if you're interested. It's a program where you get to go to the hospital, uh, work with the doctors or intern." Like, they didn't really give exactly, like, the details.
So once you were now in the program and in the internship, what surprised you the most?
What definitely surprised me the most, like, the dedications guys put into the program. Like, it was, like, really well structured out. Like, I remember, like, going to the orientation and we got that booklet. It was just like, "Oh, what are you gonna do in week 1? What are you gonna do in week 2?" And so on and so forth. And that was really, like, surprising because like, I feel a lot of programs and, like, specifically geared towards, like, high school students, they're not really, like, really organized from what I, like, experienced, and I was just really impressed by the program.
That's awesome. That warms my heart more than you know, right? More than you know. When you think about now, as you were going through some of the rotations, was there anything that you thought healthcare was going to be like that now this internship then changed your mind?
Honestly, nothing really in the sense. Like, I feel like the program definitely gave me the opportunity to like see what is be like to be in a clinical rotation, what to be like in a delivery clinical. But otherwise, I had a little bit more experience compared to my peers. 'Cause a lot of the students who are going into the nursing program, they never got the opportunity to like be in a hospital or intern at a hospital. Um, but I got the chance to see what it is to be in a hospital to intern someone.
That's good. Was there maybe a specific moment or rotation or even an experience during the Future Ready NYC internship program that really stuck out to you?
Okay, yeah, definitely. It was like the week of spring break. We had to do like the whole week of rotations, and one of them I got put into like this rotation in like a labor delivery unit, in Lenox Hill, and I got paired up with an NP, and she took me around like what her days look like the medication she was giving out, and like her going into like the patient's room and checking on the mother, checking on the baby. It was definitely interesting because at that time, like, I was already accepted to NYU nursing program, and I didn't know what to expect, honestly, because like, no one in my family was a nurse or no one at least in the medical field. Just experiencing firsthand, I was just like, "Oh, I'm excited what to expect in the future. I'm really excited what I'm gonna do in nursing." Right now, I'm not in my labor delivery unit rotation yet. I'm still going through, like, the adult and elderly, rotations, which is 2 semesters. But I know my senior year, I'm gonna be so excited going to labor delivery. I'm like, "Okay, I remember doing this back in Future Ready." That definitely opened my eyes, and I definitely, like, sparked an interest of me to become a labor delivery nurse. So that's definitely what I took out of the program, and I'm really happy that I got the opportunity to at least shadow her and even talk to her. And she was just telling me about her whole experience, her education and nursing school and stuff like that. And I kinda wish I could've still reach out to her, but I didn't ask for her number, her LinkedIn, but, that was just a good moment. And another, like, moment stood out to me was, like, I think, like, that same week, I was put in, like, a different rotation, and I was paired with a nurse, and she was telling me, like she was, like, talking to us, and she's like, "Oh, like, what are you guys gonna do after high school?" And I was like, "Oh, I'm going to nurse school." She's like, "Oh my god, are you excited?" I was like, "Yeah." Like, I don't know what to expect, but yeah, I'm definitely excited. And she's like, "Oh my god, like, you should, like, come work here after you graduate, blah." And she's like, "What do you wanna do? Like, you wanna do labor and delivery? Like, what do you plan to do?" I'm like, "Honestly, like, I don't know, but, like, I actually am interested in, like, delivery." Um, she's like, "Oh, maybe be a travel nurse. There's so much options to nursing." But I felt like, oh my god, like, she, like, understood me for a bit, and she just encouraged me, was like, "Hey, be excited for nursing school. There's so much to come." And yeah, it was a really, like, bonding moment, so
That is so cool to hear this many years away from your experience, how that still sticks with you. What did it mean to you to be around professionals who believed in you and supported you in that way?
it meant, like, a lot to me, like, I was extremely grateful. I feel like those moments where I got to, like, talk to nurse practitioners, nurses, nurse educators, because like, it opened my eyes to, like, there's so many possibilities, like, I could still go to school for, like, outside of nursing school, like, if I could do nursing and be an NP later down the line, like, I didn't know that there was so much more to nursing, that makes sense. I could still go to school and, be NP or be a nurse educator if I wanted to. Honestly, I didn't know those existed. I felt like once, like, out of Lennox, so, like, I started searching, like, okay, like, I actually wanna be an NP. I'm still considering going to NP, like, school after, but who knows? I'm still 50-50 right now, but definitely those moments, it made me realize what to expect in my future as a nurse. So, I was, like, really excited, so
Yeah, that's the beauty of these types of career exploration programs because you all do get a chance and we really strive hard to show you the different possibilities that exist in healthcare. I want to ask you kind of pivot just a little bit and think about when you think about who you were before the program and who you are now. What's different?
I feel like before I was really optimistic. Like, I feel like I had my life together in the sense of, like, I'm gonna go to nursing school and that's it. I was gonna go to nursing school and just be done. But I felt going to the program and, like, other program, I got to experience and, like, connect with other medical professions that may be interested in, like, "Hey, what if what if I, go to school again after nursing school?" And now, like, I'm, like, really interested in going to NP school. Let me think about maybe being a nurse practitioner or also just looking for internships that definitely spark an interest with me, like, to look for, like, externships and stuff like that. So, before, I just thought going to nursing school and, like, that's it, like, call it. That's literally it I was gonna do. But other program, like, there's so much stuff I could do post-nursing school. That specifically was, like, one of the big, like, takeaways that I remember in that moment.
I love that. And, Northwell has a lot of externships. And so if you're ever interested, by all means, definitely keep us in mind. When you think about your skills now, is there a skill you didn't realize you were gaining at the time you were in the program that you're like, oh, wow, now I have this skill coming into nursing school?
Yeah. So, definitely, like, being confident talking to the patients. I'm really thankful for that week of, like, spring break and other rotations that we had where we got the chance to, like, go into the patient's room and kinda, like, observe how the healthcare professions interact with the patients. I'm really, like, grateful that the program definitely, like, gave me the opportunity to, watch how nursing professions, like, talk to, like, the patients and even, like, medical professions, like, I feel like I never thought it was so important until, like, nursing school, they're like, "No, like, you have to learn how to talk to patients." And I was, like, shadowing with, like, the NPs and, like, doctors. They made it look so easy. And I feel like for me, I'm won't lie, I'm kinda struggling a little bit, but I feel like I got better, or at least I had a sense on what to, like, do compared to my other peers, like, they were just fresh, like, fresh eyes, but I felt like I already had those fresh eyes and, like, at the program at, like, Northwell.
I love to hear that, and it's really a shout out to our nursing team because the things that they do during nursing orientation, we talked about the culture of care, is something that is ingrained into all of our nurses throughout the health system. It starts from our Institute for Nursing. So I'm glad that that really helped. And shout to our nursing team for continuing to plant those seeds. And I appreciate you mentioning it. If a student were considering the Future Ready NYC internship, what would you want them to know?
I'll definitely want them to know, like, even if you're considering going to the medical field, just do it, honestly. Like, just sign up, do the program, and, like, you don't even have to be, like, become a nurse or a doctor. Like, there's so much more to that, and I definitely appreciate the program, like, opened my eyes to that. Like, there's so many opportunities within the medical field and beyond. Like, they kinda engraved us that, and as a high school student, I didn't know there was so much opportunities outside of the medical field. And if I was gonna tell a student considering it, just do it. You could take one thing out of the program.
I appreciate that. And if you could say one thing to now leaders or partners who support programs like this, what would you want them to understand about students who are coming through?
I, like, want to understand, like, there's a lot of students who don't like, families or friends are in the medical field. Like, for example, like, I mentioned I'm a first generation student, so I, like, no one in my family's a nurse, no one, like, is in the medical field. So I really appreciate these programs, like, they actually, like, help a lot, like, students like myself who are, like, don't have anyone in the medical field and, like, wanna explore more options, explore what it, like, feels like to be in the medical and just, like, learn more opportunities, honestly.
Oh, that's great. And when you look ahead, where do you see yourself going next? I know you got a few more years to go before you graduate, but where do you see yourself going next?
So where I'm heading next, I think I'm just trying to finish my clinical rotations. I'm still doing my clinical rotations, so I'm still trying to figure out what exactly I want to like do. Along the way, I kind of like spark an interest into like, become a pediatric nurse, but I still exactly don't know, which is kind of like a good thing because I'm still being very like open-minded and going through my clinical rotations and seeing what I like, what I don't like. I'm basically on track to graduate in May 2020 2027, and that same year I'm going to take my NCLEX.
No. And does Northwell still feel like a place you could see yourself?
Yeah, definitely.
Good.
Definitely some application. When when I pass my NCLEX.
I love that, and we'll be excited to welcome you back. So we'd love for you to apply. I really appreciate you telling us your story about your experience in the program. Before we wrap, is there anything we didn't talk about that feels important for you to say that you'd want people to know?
Yeah, of course. So I was got the chance to connect with Michelle. I don't know if she's still in the program. Um,
She's still in Linux. She's still around. Yes.
so yeah, it's crazy that I recently got like to talk to her. Kind of like I saved her number. I remember as a high school student because like she went through nursing school. So I was like, okay, I'm definitely gonna reach out to her at some point. I don't know when, but at some point I'm gonna reach out to her. And I recently like sent an email out. I think the beginning of my nursing school, I just like wanted to catch up, and she actually like reached back to me, and like we hop on a phone call, and we're just talking about like nursing school. It was just like a good moment because it was just like, oh my god, it's been so long. And I just like talked to her about like my nursing experience and just like so far like going to my clinical rotations. And she gave me advice what to expect and like the challenges like face in nursing school. And she's like, don't worry, like you got this. Just put all the work you need to, and you're gonna do good. Like don't worry, like you got this. And I was like, I in those moments like I actually needed those words because I felt like I was like kind of like there was so many challenges in nursing school, but definitely hearing those words out of her mouth, like, it encouraged me to do, like to continue, to not give up, and it's not an easy profession, and she kept telling me that's not an easy profession, you gotta put all the work, all the studying, but she's like, "It's gonna be worth it." Literally, she's like, "It's gonna be worth it, don't worry, it's gonna be worth it." And definitely that moment was, like, very meaningful to me because, like I said, no one in my family is a nurse. I don't think my parents know what it takes to be a nurse. So having that connection with someone that I could, like, speak outside of, like, the program was, like, so meaningful, and she literally told me, she's like, "Hey, like, here's my number, like, if you need anything, just, like, text me, don't hesitate, literally just, like, shoot me a text," and it was just, like, a meaningful moment, so
That is so great to hear. Michelle, thank you so much for just continuing to engage with the students. And I think it's a great call out to the facilitators who actually help put on the program. I often say how, yes, I may like lead some of these initiatives, but none of this work comes to fruition without the dedication and support of like the hospital presidents, who are leading the sites, and then the team members who actually then implement the sessions. And so facilitators like the Michelles of the world making that connection with the students, that means so much that you one mentioned it and brought it up, and also that you all are still in touch and that she is still committed to helping you all. Because those when I say that to you all in the beginning in orientation, and I mean it, right? When you meet all these folks, get names, get numbers, get email addresses, because we are genuinely here to help you all succeed. And so I'm really happy that you have taken us up on that and are still in touch with Michelle. So thank you so much, Vanessa. I just want to thank you for one, taking the time today, and of course for being a part of Future Ready NYC, the internship program. It's something that we have been very excited to host and continue to roll out. You lending your voice to this conversation, I think, is definitely something that's going to help future students see not only what's possible, but also the leaders and partners who are involved with this to see in real time what the impact is of these types of programs. So thank you. All the best in nursing school. And I hope to hear from you soon. And I hope you have a great rest of the week.
Thank you as well. Thank you for having me. Guys, I'm definitely grateful for this program. I wouldn't be the nursing student I am today without Future Ready NYC. So, yeah.